thank you so much for attending today's Lunch and Learn. This is one of the programs that the Wesco Chamber hosts to allow a small business to demonstrate the services that they offer and what they can bring back to the community. So my name is Kayla Descendes. I am the Marketing Event Specialist for the Wesco Chamber. And we're proud to have our sponsor here today, Amenity Direct Care, when they're going to go ahead and pretty much explain everything that they offer to the community and all of the services that they bring forward. So thank you so much. And first and foremost, we would love to have everyone in the room to actually share a little bit about themselves, just a quick name and occupation and the place of work that you work at, just so we can give Amenity a chance to get a feel about who's here in the audience. Starting off with Ms. Jen Chavez.
Hi, good afternoon, everyone. My name is Jen Chavez, and I am an independent city consultant here in the Wesco area.
Hello, my name is Joel Craig. I represent a company called Access Water Technologies, and we specialize in reverse osmosis and water softeners.
Hello, good afternoon. My name is Natasha Gonzalez, and I am the Marketing and Business Development Manager for Nat Medical Center. Thank you.
Hello, everyone. My name is Lorena Hernandez. I'm actually here because they manage my mom, and I'm very appreciative of that. But I work for Amenity. It's an international global company, and I'm one of your certifiers.
And hi, my name is Gonzalez, and I'm here representing today Texas Healthcare Alliance. We are a networking healthcare-based organization. So it's fairly new. We launched this month. Next week, as a matter of fact. So we hope to partner with the West Area Chamber of Commerce as well.
Well, my name is Daryl Smith, and I'm with Smith Security, and so I'm here to support the Chaka group, and we actually have their services on our company, and we love it. And I remember when he came up with the idea, or was talking about it, and here we are. Boy, almost like 10 years later. So anyway, so congratulations. It's really great, guys.
Hi, my name is Roy. I'm a 7 mile with Davis Real Estate from here from Wesco.
Hello, my name is Monica Hernandez, and I am the international vice president.
Hello, everyone. My name is Alex Montenegro, and I'm with Frost Bank, and I'm here to support. I'm here to support, members of the chamber, and I'm also on the board for the Chamber of Commerce. So, thank you all for doing this, and thank you all for joining us.
Good afternoon, everybody. My name is Olivia Mendoza, and I'm the Public Relations Specialist for the Mid-Silver Valley. Productive, and I'm just happy to be here. We love to collaborate with the community. Nice to meet everybody.
Hello, everyone. My name is Lynette Castillo. I'm double representing today. I'm with the Aurora House Organization. We're a nonprofit end-of-life care facility, and I'm also representing Leadership Development Class 19.
Still morning, guys. My name is Marisol Nunez, and I'm a realtor with Davis Real Estate.
All right, we're going to go ahead and get started with the presentation today. So I'm just going to hand it off to Michael, Angela, and Patrick Gonzalez. Thank you so much.
Hey guys, good morning. First of all, thank you for taking some time to come see our presentation. I hope you are able to gather some great information in regards to what we're doing here in Wesco and our surrounding community. But first and foremost, let me reintroduce myself. My name is Patrick Gonzalez. I am the Marketing and Business Director for Amenity Direct Care. We have Mr. Michael Menchaca and Mrs. Angela Menchaca. I was going to call her Mrs. Michael Menchaca. This is Angela Menchaca. They are both the providers and the owners of Amenity Direct Care. So moving on to slide number 1, just very general information. So Amenity Direct Care started in Harlingen with their first clinic in 2018, and then expanded into the Westico area in 2020. So I'll give you guys just my input on exactly what it is and how we're differently structured from other clinics in the valley. So Amenity Direct Care is a direct primary care facility. What we really hone in on is trying to provide easy and efficient healthcare for our patients. outside of traditional health insurance arena, right? And so what Michael found prior to starting Amenity was he was working, I lived at Wellman at that time, and just the ability to service and care for patients in that sort of traditional setting was very difficult. It was based more on volume, it was inefficient, there was a lot of care that he wasn't really able to, the one-on-one care he wasn't able to provide, just because of the way those systems are structured. The other thing that he found was pricing on healthcare was exorbitantly high, right? So in and of itself, guys, healthcare is not expensive. It's relatively very affordable, very manageable. What makes it expensive is health insurance, right? The middleman. And so what he's trying to do is eliminate the middleman and provide that direct care directly to the client, or to the patient, I should say. So, definition, DPC, a type of primary care billing and payment arrangement between patients and clinicians without insurance claims. So, it's basically, guys, set up on a month-to-month membership, very similar to what a gym membership does, right? You go to the gym when you need it, you don't go when you don't need it, payment stays the same, and they provide all the amenities you need to keep yourself healthy. Same thing with Amenity Direct Care guys. It is very simple to use, very convenient. I guess one of the best attributes is the efficiency of how it works. Again, it's a one payment, and it includes multiple different services. And so by including all these different services within Amenity Direct Care, it keeps prices relatively low, because you're not having to get outsourced to specialty services. The majority of what can be done there at the office, thereby saving you money in the long run. So what type of services do you guys provide, or do we provide, you might say? Number one, always the obvious primary care services. We do specialty care services as well. If there is some sort of scenario where it is something outside the scope that we can do in the office, Michael and Angela are able to bring in specialists via telehealth to help with whatever the scenario might be, and they're able to complete that same procedure if they can in-house. Again, keeping money in your pocket, right, without having you guys having to go spend on co-pays or deductibles for specialty services. So again, it's primary care services, specialty care services. They do hormone replacement therapy, they do pediatrics, they do gynecological care, they do pediatric care. So the majority of what you're seeing multiple different doctors for at this moment in time is something that can be done very efficiently within the offices here in Amenity. As far as pricing is concerned, let's talk about that. It's one very simple membership price. The majority of what you're going to be using the service for are included in that price. Any out-of-pocket costs are purchased at wholesale pricing, right? And so different scenarios that Michael will talk about is, in most cases, we do have plenty of clients who have traditional insurance, but they find the convenience of using them to be far worth, right, whatever they're having to do at these primary care facilities, where they're having to wait 2 hours to see a doctor, where that doctor's felt booked. Which leads me to my next benefit. If you have an appointment at 10 a.m., you're going to see one of the providers, the main providers there at 10 a.m. You do not double book. You'll be out of there within 15 minutes. You'll have everything that you need in order to get better, right? So we make it very easy and convenient. This is where it really comes into play for small businesses, right? Obviously, cost. I know most of you guys, most of you business owners are in a situation where, hey, I want to start incentivizing my employees and show them that I'm caring, right, by purchasing them some sort of healthcare plan. But traditional healthcare plan allows, it just doesn't allow it. It's one of the biggest overhead prices that you're going to find within the business, right? Per employee, you might be paying upwards of $150 for them. And then for them not to see the doctor or utilize it, or for the doctor to make it difficult for them to utilize their services, right? It just really makes it out of reach for you as a small business owner. So we understand that. So not only can we see individual clients on an individual basis, but we have special pricing for small businesses. And within small businesses, we make it very convenient as well. We have the ability to do on-site visits. So if you have a small business and you want to make it convenient for your employees who sometimes don't have the ability to see the clinicians outside of working hours, we can actually set an appointment to see each of your employees within your business site. Again, it comes with part of what we do. And then we're going to send you a monthly email to kind of show you, hey, your money is worth it. This is how you guys are utilizing our plans. And as far as being able to reach out to them, hey, in most cases, we're able to set appointments within 24 to 48-hour turnaround time, as opposed to having to wait 2 weeks to see a traditional PCP, which was my biggest concern, right? And I'm actually coming into working with them as a patient who really didn't understand how it worked once I figured out, right? Hey, it's easy, it's convenient, I'll never go back to a regular PCP, to be honest with you guys. You know, I have, you know what, I'll get to my personal experience here in just a bit, but let's continue with this. So, services provided, extended visits, work visits, free in-house procedures. Oh, let me talk about that. Let's just say one of you guys or one of your employees is a patient with us, right? They have an accident, they cut themselves, they require stitches, they have to go to ER. Let's just say they don't have Amenity direct care. They go to the ER, they have to pay a copay, they have them at the deductible, they stitch them up, they send them home, they send them a $500 bill for stitches and entitlement, right? Well, guess what? That same scenario with Amenity. You give Mr. or Mrs. Menchaca a text, right? They do text help. If it's urgent enough, they will come in, they will open up the office, they'll stitch you up, they'll give you some Tylenol, and then that's it. And guess how much that costs? Zero. It is included in the services that we provide. This is how we're able to save money for you guys in the long run as well. So, extremely discounted labs. Okay, so let's put some scenarios into place here, and I'll go very quickly. He'll talk about some situations where there are maybe MRIs or some sort of imaging that needs to be done. So outside of in traditional healthcare, right, they have to go to get an MRI, they have a deductible. Pricing for the MRI is like $500, right? And because they have insurance, they can't buy it. Whereas with Amenity Direct Care, they have agreements with partnerships with other local services in town, where that same MRI might cost you a third of the price paying privately. And this is something that they pre-negotiate for their employees. And then our labs are wholesale, guys. I used to go to traditional PCP and get charged $75 for them to draw my labs. It's $2.50, I believe. Don't quote me on that. It's pretty close here with Amenity. But again, savings go beyond just the monthly membership and everything that we provide to keep it in-house. Let me see, same day and next day appointments, clinician's direct phone number and email address, which is great. And then 24/7 accessibility for urgent matters. All right. Now, how are we able to do this? Well, obviously, there's a limit on how many patients that we can take. We're well below that, so no need to worry. But it keeps things manageable, and it keeps them the ability to have a direct line to the clinicians, not to a 1-800 number, not to a 24-hour customer service line, to them directly. And again, I'll go over some specific personal scenarios that they've been able to help me with in just a bit. But moving on. So, I mentioned some of this before. What do we offer? Preventative care and wellness visits, chronic disease management, thyroid, blood pressure, cholesterol, diabetes, pretty much everything that's being done within your PCP doctors. Urgent care services like stitches, IV fluids, treatments of abscesses. One of those big things that I've been seeing going on in the community is those IV infusion companies, right? Well, you know, the pricing can be pretty hefty. Well, for our members, we have special pricing, sometimes $100 less than what you're going to find with these other standalone businesses. But all inclusive. Big one also is hormone replacement therapy for men and women at very affordable prices, right? Access to virtual specialists for complex cases, and then advanced services like weight loss treatments and hormone replacement therapy, right? So he'll talk about this in just a bit, but he's a very holistic provider. If there's a way that you can come in and you want to monitor your chronic illnesses without having to jump onto medication, guess what? He's got a plan for you. He will visit with you monthly or regularly to ensure that we can do this without having to get on medication. And if need be, he will get you on medication, but with a game plan to get you off as soon as we can. It's not about keeping you in that cycle. Why traditional primary care is better than why direct primary care is better than traditional clinics insurance. Number one, zero copays. Spoke about this before, right? It's all included in the monthly membership. Number two, zero deductibles. You don't have to need a deductible. Okay? You see the same person every time. You're not seeing any other person other than Mr. and Mrs. Menchaca. They do have a very small our very small support staff, RNs, things like that. Simple, transparent pricing. You're not going to get a surprise bill at the end of the month, right, that you weren't ready for. Everything has already been explained beforehand. And then care when you need without the hassle, red tape, or breaking the bank. And then because you have their numbers, you can get to them quickly, and we have longer appointments. We can focus on proactive, continuous cares, which means your health will improve. So basically, if you call them, you text them, you say, hey, Michael, this is a situation. He'll say, hey, this is something that we need to come in, or hey, by doing this and this, you will find yourself getting better, and then I'm going to go ahead and I'm going to prescribe this. It's already sent to your pharmacist, and within like 20 minutes, you're like, oh, you did all that? And it's a Sunday evening, and I was kind of freaking out about my kid being sick, like he always is Sunday evenings, right? So it just makes things very simple, right? So 10:30, again, we are on time with our appointments. One of the biggest inconveniences for employees who have to leave the office is you have to take an afternoon off just to see a doctor. No need here. So employees, if you're looking to purchase, come on a small business plan, you can rest assured that your employee will be back in the office within 30 minutes. And if it's longer than that, you can call them and say, hey, your appointment should have been done like 15 minutes, but we're already, so rest assured it is efficient we are efficient with time. Access to your clinician with simple text during your lunch or office hours, no bills in the mail, and no delay care because it costs too much. So I will, no, this is, let me see, office visits. So old plans, right, limited to 8 per year, $10 copay. With us, there's no limit. You can see them as often as you need. You can text them as often as you need. Virtual visits, all included. Prescription drug, we do offer discount cards. Remember, if you guys aren't going to be using traditional insurance, you may have one, but you still may take advantage of Amenity Direct Care. We'll provide you with a different option. Sometimes it's going to be less expensive than using your insurance card. Preventative care, again, discounted preventative care tests, labs and x-rays. Again, there are different plans that they've negotiated with their partners, as low as $3 to $5, and then specialists, unlimited access to virtual specialists. So, before he gets onto different real-life scenarios that he's able to take care of there in-house, I have been talking to you about my personal experience with him. So I came to know Michael first as a patient. We ran into each other. He said, hey, you know what, I'm starting this clinic. Here's how it works. And the first thing I said, which is I hear 90% of the time with people who I'm prospecting and marketing to, oh, thank you, but I already have insurance. He said, whoa, hold on, let me kind of show you the difference, right? Give me a chance, use my membership for 3 months. If you like it, hey, there's no month, it's month-to-month contract, so there's no like long-term contracts. I said, okay. And man, it was night and day. Again, the convenience, the low cost. I mean, I was spending for my family with the company that I was working for at that time about $700 to insure them and myself, right? So what I did was I cut that out. I no longer use my traditional healthcare insurance to cover my family. Now, obviously, my cost was free, but I was able to save, I think, $400 a month by switching my care from Blue Cross Blue Shield over to Amenity. And the difference in care was night and day, guys. Night and day. And it's been a blessing. They're close family friends of mine now. And like I said, I have a 9 and a 5-year-old. And for those of you guys who are kids that age, hey, every Sunday, 7 o'clock, one of them's getting sick. They start a random cough. And you're like, oh my God, it's going to be a long night. So it's as easy as texting my phone and she'll say, hey, here are the symptoms. Here's what she's feeling. What do you think? Well, you know what? This was what it might be. Let me send this over to the pharmacy. It'll be ready in 20 minutes, and they saved me a night's worth of restless sleep because of the immediate attentiveness to what they bring to their patients. So, without further ado, guys, I'm going to bring Mr. Michael Chaga here to kind of go over specialty scenarios on different things that he's been able to do in-house in his facility.
Right, good afternoon, everybody. Thank you so much for being here. I know it's Monday. Tomorrow's a big day for a lot of businesses as well, so I really appreciate you spending your time here with us. But I'd like to go over some real-life situations of how direct care works, right? Because saying oh, everything's going to come at a monthly price and everything sounds pretty, but what does that really mean when something goes wrong? So I have a few patient examples here. We had Mr. JB about 9:30 in the morning. We had him in at 10 a.m., out the door by 10:20, which you consider the testing. And the significance there was he reached out with a little bit of urgency, like, hey, I have a really busy afternoon. I'm not gonna be able to come in. This was a time when, we were still masking up post-COVID. Everybody was a little bit more aware of the URI symptoms. He needed to get in, we got him in, got him out. He didn't have to reschedule any part of his day because everything was in the afternoon. We have another individual, AF. We teamed up with virtual hematology for iron infusions, which ultimately saved her over $1,000 she would have spent going to the hematology office for those same infusions. And this is just a simple case of resistant iron deficiency anemia, not responsive to oral treatment. We needed to step it up a bit to get her feeling better and take her money in the process. Mr. M, this was an individual. He had injured his Achilles that morning during a workout, and we actually got him in at 8:45 and back to work by 9 a.m. And so that type of urgency, that type of availability, that type of flexibility is what really helped really expand our services and get to the numbers that we're at now. Because those are things you just don't see. Even if you go to an urgent care, you're going to be there for at least an hour. If you go to the ER, it's going to be even worse. You're probably waiting 2 or 3, especially if you don't have like a life and death emergency. And so when you feel unwell in the future, you can simply call us, text us, and we usually try to take care of things right away. Not usually, 100% of the time we try to take care of it right away. And one of the big things, like when folks come over, that's the first appointment, they're a new patient with us, one of the things I try to teach them, the hardest thing to get used to is that you don't have to come in for everything, which is a behavior that's been ingrained since we were kids. Anytime you need anything from a doctor or a doctor's office, no matter what it is, it's like you have to go, you have to go. You need a refill? Come in, we need to do a visit. You need a note? Come in, we need to do a visit. You need this? Need a visit. And the reason that is just the way that the system is designed is you being there allows them to generate the super bill, which they would then send to your insurance company. So it's basically like, okay, let's squeeze a few dollars out of your prescription refill, right? Not how can we make your prescription refill super convenient today? And that's what we do. So whenever you need things like that, it's simply just a text, hey, I need a refill, hey, this and that, hey, I was there last week, we forgot to do the school excuse, can you send it over? Sure, email it right over, things like that. In other words, we don't make you come to the clinic unnecessarily. If we need you to come to the clinic, it's because we need to put our hands on you, we need to listen to your lungs, look inside your ear. It's been a little while, we need to catch up, hey, how are things going? So on and so forth, because we do want to be proactive as well. We don't want to just be reactive to everything. And for that level of convenience, that's what our members have really come to love about our practice. So typically, an individual runs $89 a month. For employers with 3 or more employees, the cost is $50 a month for adults ages 20 plus. Children 0 to 20 can come on at $15 a month. And if you have a child over 20 and in college, talk to us separately. Oftentimes we do provide that same discounted rate to college students. We also extend that discounted rate of $50 a month to your spouses and partners. And it's approximately a $500 per month savings compared to traditional health insurance that is already extremely difficult to use and riddled with hidden costs. Now, these scenarios are a little bit more in-depth. I really pride myself on still being like real healthcare and not just a place where you come get Botox or an IV infusion and things like that. And so a lot of times it's like, well, how does the model hold up when stuff really hits the fan? And so that's what these scenarios are. So we recently saved a member who was insured through Valley Baptist actually, $1,300 on an echocardiogram, arterial ultrasounds of both legs, and EKG. They were going to charge him $1,700 using his insurance, and we were able to do it all for only $400. That's more than a year's worth of membership right off the bat in savings. We recently had a husband and wife from our Harlingen practice that were traveling in Ohio, and the husband ended up tearing his calf muscle while he was away. And they called me. It was a Sunday, I think about 1:30. I don't think the Cowboys were playing yet, but it was a Sunday. And we hopped on a call, we hopped on a video chat, I took a look at the calf, had him do a few exercises, and we were able to get him treated, and he flew in Monday and drove straight to our practice from the airport, right? And what that did was that saved him an unnecessary ER visit in a state that he's not familiar with, where he could have very easily ended up at a facility that was out network, which those costs would have been tremendous. We had another uninsured individual who we diagnosed with hepatitis C, which is a very complex liver condition. And we were able to diagnose him, get him his expensive medication, and cure him without him having to spend anything extra. Okay. Literally. I think his medications were like $5. And the labs that we did with us in our practice, they were less than $25. We used virtual hepatology in this case, patient assistance program for his medication. And if you Google what is the cost of treating hepatitis C, you're looking at approximately $50,000 to $100,000. Now, another one of our members needed shoulder surgery, and he was quoted $30,000 here locally. We were able to get him the surgery he needed for $7,900. He put $4K down towards that $79,000, and he paid the rest in payments. And we've had numerous members come to us with a history of going to the hospital 2 to 5 times per year, and now haven't been inside the hospital in 3 to 5 years because they're able to get in when they need to. They're able to get the things that they need without any delays, without worrying about the cost and affordability of those items. We've had many come to us with uncontrolled blood pressure. Nobody can get it down. Our blood pressure is not controlled, so on and so forth. And now we have them controlled. And then again, one of the things that I love the most, people come to us on 10 meds, and then we get them down to 5 or 3. People come to us with 5 meds, we get them down to 2 or 1, because a lot of the problems that we deal with today are lifestyle problems. But if we don't talk to those lifestyle problems, then we can't fix the lifestyle and thus the dependence on medications. And too much of healthcare right now has become, here's your medication. So if all this sounds like something that can help you or your business, there's a sign-up sheet that should be going around, or at least somewhere around. You can fill out the information there. And if you have any questions, this is where we will open it up for any questions. Yes?
So you have a location in Westville and Harlingen?
That is correct.
Just 2.
The 2 locations.
Do you have a capacity for how many patients you can treat?
I'm sorry?
Do you have a capacity for how many patients can enroll and treat?
Yes, so generally it's about 400 to 700 patients per clinician is the general industry average. The industry is still very new. We're like this model, rolling out across the country, is still very new. But it's about 400 to 700 patients per clinician, right? Where comparing that to traditional practices, they might be at 1,500 to 3,000 per clinician. Good question. Anything else come to mind? Yes, we'll go 1, 2. Go.
Me first?
Yes.
Okay, so, obviously, husband and wife, right? So, you guys say that there's 24-hour healthcare. I'm pretty sure you guys have some kind of time off, right? And you're not working 365 days out of the year. If you guys are both out on vacation together, do you have somebody else that is available for those 24-hour, like God forbid something happens and somebody needs like, who might need stitches right away?
So what I heard was like, how do you guys handle vacation, right? What do you guys do for your patients while you're on vacation, right? But good question. So we actually do stay on call when we do travel wherever we're going. The only time that we've ever taken an extended trip was our honeymoon, and then everything else is like weekends only. But we stay on call. A lot of healthcare can be done with phone calls, pictures, stuff like that. We have RNs here, we have our nurses at the clinics that are available. Like somebody messages me like, hey, I pulled my back. Hey, cool. Like, we can get you an injection. I'll send you a prescription. And of course, during that conversation, we're rolling out some of the red flag conditions, the urgent conditions that require a step up in care. So the nurses there can handle some of that for us. In certain situations, we have contracted with local urgent cares, where if we do have a situation where a patient needs to go in, we take care of that cost for the patient if we're away, right? And those options have been more affordable than having somebody there 24/7, because a lot of times nobody might go in, all right? You might see 2 patients a day, but then having somebody there for 8 hours, you know what I mean? So we've talked to local urgent cares local privately owned urgent cares and all that have worked with us on that regard. We have a question?
Yes, just out of curiosity, I know that you mentioned you do a lot of telemedicine. Is there a specific service or specialist that you're seeing a lot of patients need?
A specific service or specialist that we're seeing a lot of people need?
Like you mentioned, hematology. Like, do you see that a lot from our community, like here, use that service?
I think the biggest thing that people need is probably nutritional education.
Oh, wait, that's like more classes.
Yeah. a lot of our individuals, we have a mix of individuals who are chronically sick, have a lot of things going on, and then we have individuals who don't have anything going on, but they want something low cost. They know they don't need to pay the exorbitant cost of insurance, but still need coverage. So these situations, like we saw here, those are not day to day, right? But we have that flexibility when they come up. Most of it is going to be based around lifestyle. So I would say what the community needs, probably like nutritional education, nutritional resources, things like that. Endocrinology. Yeah. Yes, ma'am.
Are mental health services something that you all offer, or is it just a prescription of the person?
Yeah, so one of our core philosophies is that a lot of what's going on with your healthcare probably can be tied back to four main pillars, which is going to be stress, sleep, exercise, and I always forget what it is: stress, sleep, exercise, and sorry, nutrition. Yes. But speaking towards stress and the type of stress that comes from different mental health conditions, even if you don't have a mental health condition, a lot of times there's still chronic stress. I would argue that our society breeds chronic stress on multiple different platforms. And so we talk to those areas first. And I'll give you an example. I had a gentleman who had very diabetic. We got him controlled, and then all of a sudden he's very uncontrolled again. And the typical response would have been, well, let's up your dose, right? What are you eating, right? But my response was, hey, like, what's going on in your life? And he's like, my brother just passed a month ago. And I'm like, oh, okay. Well, what is that causing in your life? And then he tells me those behaviors. And I'm like, okay, well now I understand why his diabetes got out of control. It's because he's having a hard time with this particular life event, right? And we take that approach on with people who have mental health conditions and people who don't have mental health conditions. And that's how we're able to get rid of some of these medications, because I would argue that is true root cause medicine.
Thank you.
You're welcome. Yes, sir.
Do you guys have, chiropractors and, dental type people in your network, in your special?
Dental and chiropractor, no. No, thank you. Yes, sir.
Your fee schedule, your structure, is it locked in for how long or how do you adjust your fee schedule?
So super simple, super convenient, no complexity. It's a month-to-month thing. You can cancel anytime you'd like. You can enroll anytime you'd like. For a company who has employees, they can come on anytime they'd like. They can cancel anytime they'd like. There's no open enrollment period. You can't cancel until the next open enrollment period. There's no 12-month contract, 5-year contract, nothing like that. We try to keep the billing side of it super convenient, super simple, with a lot of flexibility, so that we focus on care.
But you do have, like say for example, you can't be at whatever fee it is right now, how can you revise or 5 years or locked in or not locked in or whatnot?
Do the prices change as you go?
Okay.
It's because he's fixing to get Social Security, so he says.
I guess to answer your question, we have raised our prices from time to time since we started, but we don't see any price increase in the foreseeable future. We really try not to change the membership structure at all. Each price increase came with new added-on services from where we initially started, but I really don't see it going any higher than that.
One thing to notate is any change in pricing is 100% told you guys.
Yes, very transparent.
Yeah, we're very transparent.
You guys know what's coming.
Yeah. Yes, sir.
So
I'm sorry, could you be a quick second?
Yes.
Did that answer your question, sir? Yeah. Okay, perfect. Sorry about that.
That's all right. So you had quoted something like, for young adults.
Mhm.
It's $20, that's theirs, or that's the price of the parents on the program?
Price of the parents on the program.
So if the parents are not on the program, then it's regular 85 for them?
For 0 to 20, it's 50.
50.
50, correct.
I spend so much with my.
Yeah, I think I grew up, my mom was working at Kmart, and we had insurance through Kmart. When Kmart went under, that's when we lost insurance. And so I spent most of my life.
Well, we have to, I have insurance with my company, my husband has insurance with his company. We have to do that because my medication is not covered through my husband's insurance, but it's
Gotcha, yeah. And we see families with situations like that all across the board, and that's the type of complexity that we aim to solve. If you'd like, we can talk privately afterwards, and we can talk about the medication just to see what the scenario would look like. Any other questions?
I have a
Yes.
question, but this is a question I ask as a patient. Number one, I have insurance, but I like your service, right? Can I still be a member of Amenity even though I have insurance? Will you guys take my insurance, or how does that work? And then if I let go of my insurance and use you guys, hospital-like services, how do you guys help me? How do you guys incorporate that?
Yeah, thanks for the platform. So we do work with your insurance if you do have traditional insurance. We basically become the steward of your healthcare, and we tell you when would be a good time to use health insurance and when would be a good time to not use health insurance and just go with the cash pay price. You can also use your insurance for medications that we prescribe, for images that we order, for labs that we order. But at the same time, there's moments and scenarios where just going with the cash price is going to save you in moments where you haven't met your deductible, or there's a time crunch or anything like that. We typically find that even the members of ours that do have insurance, they just go with their cash prices. Like we had a lady insured through Lax needing an MRI, $700. Ours was $325. We had another individual who got labs done through her insurance when we tried to convince her to use our cash prices, and she got a bill back in the mail for $450 from an insurance company. The labs were $25 at our office cash price. So a lot of times using, you actually get discounts for not having insurance at imaging facilities and different things like that. But if you tell them that you have insurance, they technically cannot offer you the same cash price. It's built into the contract with the insurance companies. What was the last one?
If I let
Hospital.
go of my insurance, hospital.
Yeah.
How do I cover that from the family?
So that's a good question. There's different ways to slice that cake. One option is if you have one of the more expensive traditional insurance options, you could downgrade it to one with a higher deductible, because our goal is to not have you pay to the deductible, because we're going to be able to provide generally everything you need. The going statistic in America, this isn't me, this is the going statistic in America, is that 90% of all healthcare complaints can be taken care of at a primary care office. The only reason that they're not is because most primary care offices don't have enough time for the patients that they have. And so our success is based on making sure we have enough time for the patients that we have. It's the hard limit, right? Now, like Patrick was saying earlier, we still have space. We are getting close to capacity, but there's still room. Now, so you could downgrade to a plan with a higher deductible. What we've had actually other local businesses do. There's a husband and wife that stand out. Remember, they own a physical therapy practice here in Westlaco. I think they have a McAllen location. Yeah. They had traditional insurance, and she reached out, the wife of that business, and like, hey, what do you guys do, and how do you guys do it, and so many questions. We also partner with a company out of Austin called Sedera. They're a health share company. That is what I have for our employees, that's what I have for our kids and our family. And they basically provide that wraparound coverage for those things like cancer, emergency surgeries, the unexpected things that no matter how well you plan, they just happen. We used it for the labor delivery of our 1-year-old son just a year ago. Very smooth experience. They help with vaccines, preventative procedures like colonoscopies and things like that. So that's another option that you can do. And that particular couple, they went from paying $1,400 a month for their health care to paying, I think, just over $400, so they're saving $1,000 a month. They've taken more vacations since they joined our practice.
Can I let you guys on a personal side on how much I've been able to save for my family, taking them off of Blue Cross Blue Shield? It did include, that cost was already including Sedera to take care of the 10%, but just in case.
Yeah, and so there's, what I like to remind folks is that health insurance is not health care access. Health insurance is not health care coverage. Health insurance is simply a way to pay for health care, of which there are more than one ways to pay for health care. Health insurance just happens to be the one that costs the most and is the least convenient. And I think we all have a general pulse on the situation that health insurance is getting more expensive and covering less things, right? Which is the opposite of what we do. Another common question I get is, I already have health insurance, like why would I pay you guys again? Like why would I pay twice? And it's like, well, sir, ma'am, you're already paying 3 times. You're paying your insurance premium, you're paying your copay, and you're paying your deductible, right? That's the insurance route. With us, you have a single payment, and you may have your insurance premium still, but then you don't have to worry about your copays or your deductibles. Yes, ma'am?
Does the membership cover pharmaceutical costs, like
we have members who are on no meds, and we have members who are on 7. So pharmacy is one of the things that we like to slice and dice per individual. If you don't need that many meds, we generally try to keep it to low cost option medications. What I find a lot is a common prescribing habit, I'll say, is to prescribe the newest and greatest drug, and that's because they'll tell you it is 20% more effective, right? But when you look at the research, the less expensive option may be 10% successful, and the new medication might be 12% successful, but that is a 20% increase, right? They don't tell you it's just 10 to 12, but that new medication might be $300 to $500, where the old medication is 5 to 10, right? And even if you have one of those insurance plans with the copay cards and all those things, and you get your medication for $20, it's still increasing the cost of healthcare across the country, which will further increase insurance premiums for individuals. So it's just a poor prescribing habit. Now, for individuals who have 5 or more medications, or generally if you're spending more than $15 a month on medication, we have a prescription option add-on. It's $15 a month to add on. We don't make anything off of that prescription plan. It's just something to offer. You get all the common generic prescriptions. I think it's over 200, and all the common urgent care medications for colds, urinary tract infections, different infections. It's $15 a month, all those medications for free. Yeah. That's how we handle the pharmacy part.
We also do a lot of patient assistance programs,
Sure.
which is good because some people obviously don't have insurance, they still have a diagnosis that needs to be managed. So we do look into that and make sure that they qualify, and if they do qualify, then we, of course, somebody from the team starts working on the application process for them, submitting that to the company and seeing if they qualify. A lot of times it's a year free of medication. So that gets delivered directly to their home. They meet all the qualifications, we sign, we make sure we're checking off the right medication that they need, we're dosing it, we're monitoring their labs in the meantime, but they get a full year supply of that medication. Of course, it's allocated like at 3 months at a time, but they qualify for that, and they renew as that year comes up. So we still want them to have access to good quality medications, especially if it's needed. They tried the generics, they're just not getting the response they need. And we just really want to make sure that their health is well managed. So we do look at those options as well. Any other questions? Yes, sir.
Okay, so sorry I was late, and so I apologize if we went over this, but like for my company, if we're insured through, and we have Blue Cross Blue Shield, one of the mandatory things we have, and it actually turns into a discount on our insurance, is an annual physical. And so something like that sounds like would be like a one-time service for y'all. Is that something that, would be covered through the insurance, or there would have to be like some kind of copay for something like that?
So, we offer physicals for all of our members regardless of insurance status, but we wouldn't be able to bill an insurance saying that they had this done, if I'm answering that correctly, just because we don't bill insurance at all. It's specifically membership based. So each company, they get that discount for their employees, and that also gets extended to their family. So the employee, they want to bring on their spouse, their children, they get a discount as an employee as well. So they get to share that discount offer. And so basically we just make sure that whatever the patients do need. I've had some people also ask, can we put this as we have healthcare, like whenever they're doing taxes, or?
Yeah, so,
Like
yeah,
a write-off. Yes.
So I guess 3 things there. We do have a company on board at our Arlington location where we have some of their employees who have the traditional insurance they offer and our membership, and they have that same annual physical. They bring us the form, we do the physical, and they submit it to their insurance company.
Okay.
We don't bill extra for that, it's part of the services we offer. But they have both, they don't have just one and then come to us just for that.
Okay.
Does that make sense?
Yeah.
But I think another component to that is, when you file your taxes, you have to have insurance, right? And if not, they will dock you for not having health insurance. Is your involvement, like, do you supply us with anything like that to let them know, like, yes, we do have insurance?
Yeah, so
But it's not like an insurance company.
yeah, no, I get what you're saying. Yeah, there was a point in time where you were penalized without having health insurance. That incident.
That's been lived, yeah.
That's no longer a event.
Yeah, thankfully. Because a lot of times people were getting insurance just to not pay the penalty.
Yeah.
But a lot of times it's like where they're paying for something every month and they're not even utilizing it. So
you
obviously.
ask you for a form if you want to provide it, like your mileage taxes. You can't use that money that you spent, and there is some kind of something.
And people also use like their HSA, their FSA for membership, so they can definitely utilize that for membership purposes or any miscellaneous charges that they may, decide that they want to partake in for some other services that we provide. So there's a lot of flexibility there. And we are very transparent. We will tell them, of course, beginning of the year, nobody's met their deductible, right? So they need something or they want something, and we tell them, well, likely, you're still gonna have to pay quite a bit because you haven't met your deductible, but this is what we could offer for you, and this is what that price would be. Because you need to know what your options are financially, right? Because obviously you're working hard, you're trying to provide for your family. Healthcare is very expensive, but we don't want that to be the thought that y'all have, coming in with our company. We want to be accessible, we want to be affordable, we want to be convenient, so we want you to have that impression with us.
FYI, I do use my HSA card for my monthly membership and qualifies, and it's pre-tax, and it makes financial sense.
Yeah. Yeah, and right now, y'all know how the economy is, not to bring that up, but just, people have to think about where their money is going, how far can they stretch it, how do they have to move things around just to make sense financially for their family. So a lot of times this is something for them. And a lot of times, like he was talking about telehealth, people don't even have to leave their home, they don't have to leave their work, they can, hey, can I get a call scheduled at this time? It's available, sure. And we hop on a call, whether it's a phone call, a video call, whatever needs to be done. And yeah, let me go ahead and send that prescription, you get out of work and your prescription's ready at the pharmacy. So we really want to hone in on making sure that you're not wasting time or money where you shouldn't.
And I want to add that I'm a patient of theirs, and so is my daughter. When she went off to college, she was so worried. No, what about Angela? I said, you can call her, you can text her, you can video chat with her, whatever, and that's what it is. She doesn't live here locally, but she can still consult with her from where she's at.
And we've had a lot of parents, they're sending their children off, and of course they're worried because they're not there, and they're the ones who've been managing, making sure that they get to the doctors. But they're like, no, you can still be with us, and anytime that they're down for the breaks or whatever, they can come see us, or anytime they're up there and they need something, we just get a nearby pharmacy and we go ahead and submit that prescription for them, or whatever they need. If they just need a visit to talk about some things, we can discuss that with them as well. We do have some specialty pharmacies that certain medications, mostly like for females, we're able to go ahead and prescribe, and they'll deliver that to their dorm, apartment, wherever they're at. A lot of people that work out of the valley, truck drivers and all that, so we're sending prescriptions, wherever they're at, because we want to make sure that they're able to have access to their medication, they're keeping their health on track. Any other questions?
I can answer.
Sure.
I'm not a patient, my mother is a patient, and this is the first time I get to meet you, but I've spoken with her many, many times. My mother has a very complex illness. She was in and out of the hospital constantly, and ever since we moved her over to you all, she hasn't been in the hospital, and they do communicate with me, and I love that, because with the other physicians, it's like, it's on their time. And I really appreciate that you take the time to make sure that I know what's going on, and I travel for work, I'm always out of town. So that makes a big difference. I appreciate that.
Thank you for sharing that. I appreciate that. Anything else?
So I have one question. So for a small business that has a few employees that would want to maybe get the process like this started for their staff and get them enrolled, what would be next steps for them to get things going?
Call Patrick.
Call Patrick, check.
Sign up sheet. But any small business that's interested in services, they would get contact information. They could call our location. Westville location number is 956-269-9185, and then we have the Harlingen location 956-230-0655. We're also online us there. We have our pages there. We have cards, we have brochures, so we have all that information. You can email us, call us, do whatever you need to access us, and then we start getting the names of all the employees. We get their date of birth, their phone number, their email address, just so we can start putting them into the system. And somebody from the team will reach out to get their first appointment scheduled with us.
Process is easy, guys. Within 24 hours of getting the information from you, you guys are able to start seeing the doctors or the providers already. So very easy, very easy.
Yeah, some people, last week I had somebody come in and she's like, my appointment's not scheduled for next week, but I have something going on now. And I'm like, that's fine. I'll bring you in, you need to be seen for this. I don't expect you to wait a week just because that's when your appointment was. So tons of flexibility because again, we don't double book, triple book, depending on the amount of volume that we see per day, because that's who we submit for insurance for reimbursement purposes. It's really just a matter of making sure that everybody has access to us when they need us. And if we're full that day, hey, we'll see you tomorrow. You know, we try to really make it work for everybody as best as we can. Anything else? Yes.
How does it work, like, with, a pregnant woman is coming to see you, like, do you guys send them to a specialist, or?
So yes, we are not able to do like ultrasounds for OBGYN purposes because, you know, they have to be under the specialist. But we do go ahead and I have a few patients that are pregnant right now, found out at my clinic. And so we do go ahead and do the testing that is needed for that and kind of give them their recommendations, make sure they're doing okay with their blood pressure, things like that until they can get into the OB-GYN's office. But we do follow them along the way. I have a couple of pregnant, I was gonna say employees, but no, patients that come in because of the heat. You know, they're like, I feel so dehydrated, so we get them on IV fluids just to kind of help them in the process. Or I'm vomiting the first 3 months of my pregnancy every day, like I need to get, you know, some hydration in. So we set that service up for them as well for very low cost. Yes, ma'am.
So yeah, now that you spoke about the IV, what kind of IV services do you provide? Like what is it that you can, if someone comes in and they need X, Y, and Z, what are the options that you have available?
So we do IV hydration for people who might be dehydrated, they have a really bad stomach bug, you know, they haven't been able to keep any fluids down, so we do that for them. We do infusions. Those are more like to help with vitamin boosting, to give them those, you know, bursts of energy that they want. We have immunity infusion because, you know, the season has been very rough, the flu and cold season. So we do offer that as well. It just helps boost their immunity during the time because they don't want to be sick. It's not convenient to be sick. And there's so many people that are sick month to month to month, especially if they have, you know, children in school. So we do offer that as well. We've even done IV antibiotics. We did have somebody come in that had a very bad skin lesion and it wasn't responding. We sent it out for culture. It was a very nasty bug, so we actually went ahead and set up IV antibiotics for this individual. I want to say he did 10 to 14 days of IV therapy, including the weekends. We were there in the morning Saturday, we were there in the morning Sunday, making sure there was no delays in treatment. We did try to call the Nevada facility to see, you know, what the pricing would be, and they told him $9,000. So we got that for him for maybe $700. So, and it was the same thing. It's just a matter of getting the right people to do it, not having to. I mean, who's gonna pay that much? You know, that much money? They don't just have that sitting in their nightstand. So it's really just a matter of making sure that they still have access to what they need. So if you can't afford it, you're not gonna, you know, seek it. So it's really just a matter of like looking at those options to see what's available. And that was our first time doing it in the office for them. And we're like, can we do this? And so we're like, okay, like who do we call for this? Who do we call for that? Let's talk to this pharmacy. And it's really like networking with everybody who needs, you know, to be involved to make sure that patient gets the care that they deserve.
I think if that's okay, we are running out of time, and I want to make sure that we will segue, guys, off that IV infusion. We actually have a what is this called? A raffle for one of our IV infusions. Very popular. Michael, do you want to give some information on what's in the IV infusion and what's it for?
Yes, so we're raffling off one vitamin infusion treatment today. So it's filled with a lot of B-complex vitamins, things that will help you with brain fog, with energy. It'll help if you're B12 can cause problems with tingling sensations in your arms and legs, brain fog, headaches. So if you just want to hydrate yourself, which is very important, and we're coming into the hot season, get some good B vitamins in that'll help boost your energy and help you think a little bit clearly. This is the perfect infusion for that. And I guess without further ado, if you want to.
Roy was asking if you could schedule it for Saturday morning.
So we all can take out the white tickets at Amenity as soon as you walk in today. We're gonna have Patrick pick out the tickets here for our listeners.
All right, I'm going to move these around, and we are the last three numbers are 541. 541.
Saturday morning is.
So guys, while they're doing this photo op, again, I just want to thank you for the opportunity for having us come and give you some more information on DPC. I'm a true believer that if more people knew there were other options of what's presented to them, that they would more than likely kind of gear towards what we're trying to do here. I have your names and numbers. I will be reaching out to you guys individually, seeing if there's an opportunity for us either as at an individual level or maybe a small business level, and we'll kind of go through that process. All right. So that's it. Thank you guys.